Hi guys, a bunch of friends are actually telling me that I should, they thought that this is really helpful and I wanted to share it with everyone, so maybe you'll find it helpful too. This is a way to actually know the eruption for primary teeth and permanent teeth, pretty much I would say in like less than 10 seconds. The way it will work is actually, I'm dividing it as far as I'm showing it as far as like how it's done through like drawing, I should say, and a drawing of two words or writing two words. We'll start with the primary and then we'll go on and continue with the permanent. First thing you have to know is primary eruption happens in months, in the big early months, and then permanent starts in years. So that will be very helpful. Okay, so before I explain this, I'm gonna show you how it's drawn and then I'll explain it better. So for primary teeth eruption, it's basically NXI or NXI. I don't know how you pronounce that, but in NXI, it's gonna be like this. That's the drawing, and you can pause and replay and to see it in a better way. And after you draw an NXI, you will know that this is the starting point and this is the end point. So basically what that means is that this is the first tooth to erupt and that's the last tooth to erupt. The first tooth is the central incisor, and it's really nice the way the primary teeth is actually erupted according to the ADA. And actually I chose all the numbers, those numbers from, I took them from ADA website, so it should be very official. Primary teeth, actually all the teeth erupt within a range of years. It's not stable of like it's 6 months, everyone have to erupt their teeth. Sometimes it's 7, sometimes it can be a little bit later. But here's the thing, I'm gonna put the number that it's definitely gonna be there in the exam. It should be there in the exam because they put range most of the time. So primary teeth starts eruption central incisor on 6 months. Okay, at 6 months of age, the central incisor will start erupting. And then I'm not showing it for everything, I'm showing it for the main ones you should know, so you can immediately eliminate, like if it asks you after central mandibular incisor, which one will erupt next or at which age, you will know that's approximately around 6 months, maybe 7, maybe 8 months. I'm not going to put all the numbers because I personally think it's too many information we already have from other sections, and I'm trying to condense it as much as possible, like what do we really need to know. So 6 months is the central mandibular incisor, and then the next number I'm going to show you is add a 1 or add a 10 to the 6, so it's going to be 16 months. And that's the mandibular canine, okay? That's the mandibular canine, will start erupting in 16 months. And then lastly, that's going to be the maxillary second molar, primary molar I should say, and it's going to be another 10 adding, which is 26 months. I'm going to add the 26 to 33 just for a reason, and I'll explain in a minute. So 6 months, 16 months, and then 26 to 33 months. Now the reason why I added 33 is because sometimes in some of the questions it will ask you primary teeth erupt usually within which range, and it will show you some numbers, and you should know sometimes they might add 6 to 26 and they might add 6 to 30 or 33, so you should know that 26 to 33 is an accurate and a valid range for a second maxillary primary molar. Also, one big point I have to mention before I forget is that in most of the time mandibular teeth erupt before their permanent ones, their maxillary ones. So usually, as you see here, most of the time it's the mandible erupting and then the maxillary. And this is more important than the permanent, which I'll explain in a few minutes. And yeah, so this is basically a replica of this, which is, so if I wanted to complete it, I'll just add, this is central incisor, this is lateral incisor, this is canine, this is mandibular first primary molar, and this is the mandibular second primary molar. And the same thing goes with the mandibular ones. And again, it's an NXI pretty much. I hope this first part helps. Yeah, if it doesn't, then I really highly recommend you to understand, to know the other mnemonic, which is it's 2 sentences. I don't remember because I stuck with this, and I feel like this is very helpful for me. The second one now, we'll start with the permanent teeth, and again remember, primary is months. This is all in months. This is in years. Here's a nice feature though. Primary molars starts in at 6 months of age. Permanent eruption starts at 6 years of an age, which is really cool. Which is like almost kind of like saying number, which is helpful. I find this is way easier than the mnemonic, especially this one, because it's pretty easy. If you like actually draw it like 3-4 times, it will be stuck in your head. You don't even need to draw it on the sheet on the exam, so you can actually save some space for other mnemonics. Again, it's a personal preference. So this one, it's the word main. Here's the thing though, the letter A, it's a little bit awkward, so bear with me. Main. Okay. And you will see that the I added, technically this is an I. The I added in the end, but it should be in the beginning. But it's just because my drawing is easier when I do it in the end, so I can know the space that I have to put for the I. Main. So this is going to be a little tough to explain. Okay. So again, this is a replica of this, so you can tell like this is the central incisor, lateral incisor, canine, first premolar, second premolar, first molar, second molar, and third molar, and this is the replica of this, but for maxillary mandible. Pretty simple to say that the first teeth to erupt for permanent teeth are gonna be the first molars of maxillary mandible and the first central incisor for the mandible. So immediately we'll go here and we'll say 6, 6, and 6, and by 6 I mean 6 years of an age. These 3 will most likely to be erupt. Here's the thing. Again, remember the point that when I say in most cases, especially for the permanent, mandibular teeth will erupt before their maxillary teeth, except one tooth. And if you look there, you will see it. It's the second premolar. Maxillary second premolar is most likely to erupt before or at the same time as the mandibular second premolar. So just keep that in mind, because I feel like that's a very, like you can see in dental anatomy and occlusion section, it's very important to understand the exceptions, as far as you can tell from some of the exams questions. Okay, so again, I'm doing the same thing. I'm not putting numbers for every single individual tooth. I'm putting numbers as far as, like, for example, the first tooth to erupt and then the 5th tooth to erupt. I'm gonna put the numbers so you can guess in between those three teeth in which range they will remain within. So after the central incisor, of course, you're gonna see it's gonna be the central incisor of the maxillary, and then the lateral incisor of the mandible, and then the lateral incisor of the maxillary, and so forth. The numbers I'm gonna add, I told you at the beginning that I think that, as Dr. Okori also said, the first and the last teeth are very important to know. But I also am gonna add some in the middle, so you will know, like, okay, I can know the difference between I can know the numbers within those ranges. So the second one I'm gonna add is for the canines, just like I did here. For the canines, it's pretty also cool because it's like a sequence number. For the mandible, it's 9 to 10 years. But as you can see, canine of the mandible erupts way before the canine of the maxillary, because you can see that it goes actually from canine of the mandible, then premolar of the mandible, or then premolar of the maxillary, then premolar, second premolar of the maxillary, then second premolar of the mandible, then goes back to the canine of the then it goes back to the canine of the maxilla. I just wrote this so you won't be confused of like what is going on here. This is the canine, and this is the lateral incisor, and this is the central incisor. So 9, 10 for the canine of the mandible, and then the third number I'm gonna add is the canine on top of it, since it's gonna go all this before it reaches the canine on the maxillary. It's gonna be 11 to 12. Again, these numbers are taken from the ADA website. It's cool because this is, I think personally, I think this is an important point, since like all the other teeth erupt like close to each other, the adjacent and their maxillary or the mandibular partner, but except the canines for the permanent. You can see the canine, well, the mandible erupts way before the canine of the maxillary. It goes to all the other teeth eruption and then goes to the maxillary. But you should know the difference, that the canine of the mandible is 9 to 10 years, and then 11 to 12 years is the canine of the maxillary. And then last but not least, I'm gonna add the last numbers, which is for the mandibular third and maxillary third. It's gonna be 17 to 21 years. It looks like they erupt the same at the same time, but most likely it's mandible gonna erupt before their maxillary. So usually mandibular third, or I should say mandibular second molar, will erupt before the maxillary first molar. Again, and this stands for MAIN. Except the A here is kind of like really struggling to make an A there. I hope you find this really helpful, and if you have any questions, please ask me and I will clarify more out of this. Thank you, and hope you pass boards.